My name is Francis Dallaire of Calm Reflections, Massage Therapy, and Yoga. I am joined today by Evie Bellinger of Bella Stone and the wonderful Kate Peck, who is recording us today of Holistic Therapies. They have a lovely practice here at 15 East Main Street in Trumansburg, and I am located at 203 East Main Street in Trumansburg. Today we will be going over the rotator cuff. I love when people say I tore my rotator cuff. Also, it's not a rotary cuff. Nothing to do with rotary. It is a rotator. Common mistake, people say. I love it too. I hide my smile well. But in any case, we're going to educate about the rotator cuff and give you a little bit more knowledge so you feel a little bit more comfortable about being told you have a tear in your rotator cuff. So first thing is, it is made up of 4 muscles, and they all wrap around the head of the humerus, the very funny bone up here, and give support to the shoulder joints. I was taught a wonderful way to memorize these 4 muscles, and they are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis, and those are the motions they do. So supraspinatus raises up the arms, infraspinatus and teres externally rotate the arms, and then subscapularis internally rotates the arms. And that's how they support the whole shoulder. So the most common one torn is the supraspinatus. It's the littlest one, and an easy way to check if that one is strained is the empty can test. And so you turn your palm, or turn your hand down like you're emptying a can, and then have someone push up, or push down on your arm as you pull up. That's going to test the arm and see if there's a tear in it. The other ones, you can do muscle resistance in those directions. So the infraspinatus and teres rotate the arm outwards, so you would pull it in as you go out, and if you feel pain up in the shoulder, you most likely have a tear in one of those muscles. And then the subscapularis is internal, so as you rotate in, have someone push out, and if you feel pain there, a tear now. But enough about the talk, we're going to get right to the body and show you exactly where they are. Alright, so on the lovely Evie Bellinger here, we're going to show where these muscles are, how they wrap around the shoulder, and then actually some stretches that you can do at home to help yourself. So we've got a lovely little bit of chalk here. And so the subscapularis, that one that most commonly is torn, and that raises the arm, abducts the arm. Starts right at the top of the shoulder, or top of the scapula here. And the supraspinatus fossa. And so you can feel the corner of the shoulder blade is right here. There's a nice little ridge that comes around, and it fits right in top. And it actually comes all the way over to the shoulder on the greater tubercle of the humerus. And that is it. That's basically the muscle. Look how beautiful that is. Draw some happy lines in there. Happy lines. You're going to look like you have wings after this, Evie. Excellent. So the next one is going to be the infraspinatus. You can guess that infra is underneath, supra is higher. They did a wonderful job naming these muscles, I feel. Bang up job, whoever did it. Probably Latin people. In any case, so the infraspinatus takes up the rest of the scapula here. So you can feel and move it in there. We're going to pop out Evie's scapula a little bit here by chicken winging her arm. Oh, there it goes already. You see it? Look at that. That's beautiful. So if the arm is able, you can raise it up onto the low back and look at it rise up there. Evie has such a beautiful scapula. Such a beautiful scapula, Evie. So infraspinatus comes all the way down, and then comes all the way on the outside too. Traces underneath the ridge of the scapula, and inserts on the greater tubercle as well. Location, location, location. A lot of muscles vying for that spot there. And you know what? All of them win. Hooray! Alrighty. So again, that's the one that rotates the shoulder to the outside there. The next one, the teres minor. There is a major, just so you know, if you were wondering. I was wondering, but then I found out, and I feel better for it. Alright, so the teres minor attaches to the lateral border of the scapula right in here. And it too comes over on, you guessed it, the greater tubercle. Everyone loves that spot. I'm running out of chalk here. I'm gonna use my finger. Ah, there we go. Look at that. This is your body, people. You all have these muscles. They run just like that. So again, that one is supportive in rotating the arm to the outside, and again, supporting from the side of, supporting the side of the shoulder. Now the next one, I unfortunately can't draw because it's underneath this wonderful scapula that Evie has here. I'm still admiring it deeply, Evie, just so you know. So it attaches to the complete underside of the scapula, subscapular fossa, as it were called. And this one comes underneath and attaches in front on the lesser tubercle. I know you thought the greater tubercle was going to have no, there is a lesser one. Subscapularis is a little more modest. It said, hey, I don't need the greater one. I can take the lesser one. I'm fine with that. And so that's where it comes, right to the front. And again, we're actually engaging her subscapularis right now with this big internal rotation. So those are our four muscles. That's how they run. That's how they lie. This is how they look. I'm rather impressed with myself here on the drawing. So I'll go through some stretches for this here. Alright, so we're going to finish up the identifying portion of this video. We're going to have stretches on part 2. And I hope you've enjoyed our little diagram here and our wonderful drawing. And I hope you join us for the stretching on part 2.